Hi, I'm Heather Poduska, personal brand strategist for entrepreneurs who are ready to make their mark and make their money. Welcome to Thrive, the show where I bring you tips, resources, and people to help you create a more abundant life and business. You're in for high-value content coming to you from industry leaders who are growing their business, making an impact, and rocking their brands. Today, I'm delighted to have my special guest here today, Dr. Gretchen Freeling. Dr. Gretchen Freeling is the owner of GFaceMD, a boutique-style medical aesthetic skincare practice in Wellesley, Massachusetts, where she combines her medical expertise with a perfectionistic drive to give her patients impeccable, show-stopping results. Dr. Freeling is a Harvard-trained physician with a 10-year-plus background in medicine and is a board-certified dermatopathologist. In addition to her impressive medical credentials, Gretchen is a Julliard-trained ballerina, which allows her to bring a refined sensibility of artistry and mastery to her work. Welcome, Gretchen.
Thank you. Thank you.
I was trying very hard to say dermatopathologist.
It's a mouthful.
It's a mouthful. And so what is that for people who aren't familiar with that term, or for TV hosts who stumble over that term? What is a dermatopathologist?
So a dermatopathologist can come from either the dermatology background or the pathology background. This day and age, physicians subspecialize, so I am a pathologist, and then I went to do a fellowship in dermatopathology, which is the diagnosis of skin disease under the microscope, essentially. So we diagnose anything from rashes to benign moles to malignant melanomas to other types of rare tumors, et cetera, et cetera. Everyone has skin. So.
Yeah. Wow. So how did you become a dermatopathologist?
So I did all of my education in Florida to start me off with all of my undergraduate education at Florida State University, and then I did my medical school at the University of Florida. Okay. From there, I came up to Boston to do my pathology residency at Beth Israel Deaconess Medical Center, and then from there, I did my dermatopathology fellowship at the University of Vermont. So.
But there was a jig and a jag along between Florida and Massachusetts and Vermont. There was some of this, right?
Yeah, there was a little bit of that, right? So you always want to have this straight path, but there's always hiccups, and you have to learn how to get around those too. But yes, I had a ballet career, but that was when I was younger even, and I studied in ballet, always having medicine there with me, and then.
So when you were ballerina, you even when you were dancing, you were sort of drawn to medicine, is that right?
I always had the passion of dance, and looking back, it gives you just such a stage presence and a way to carry yourself. You know, I try to work on my posture all the time because I feel like it's going away now. But yeah, I was always drawn to kind of the art form and the science. My sister as well were the same.
So at what point did you decide to stop pursuing ballet? Like, were you more drawn to science? Did you have an injury? Are you still dancing? Yeah. What happened in there?
I wouldn't say it was one specific thing. I think going through my high school career and then even into college, actually, I went and I danced in college, but it wasn't professionally, it was just on the side. In high school, I thought about doing professional dancing, but I am on the shorter side, and kind of just the way my body was, I felt like it was getting too hard on my body, even at that young of an age. And I decided, you know, I'm going to do this more as a passion and continue to do it. I mean, it's hard to say that you're going to do it as a passion. It was always pretty serious, but not go the professional route. And I can't say there was one thing. I just wanted to be a professional and go into medicine, and I didn't really want to wait too long. Yeah. So yeah.
And what drew you to studying skin?
Oh, that's a long one.
That's a long story. You could study feet. What was it about skin?
Yeah, that's such a long story. So in medical school, I was always like, I'm going to be a surgeon. This is what I'm going to do. I'm so hands focused and detail oriented, and I like to use my hands with surgery and all these types of things. My dad taught me how to do a surgical knot in my hair when I was so young. I still do it to this day.
Wow.
My dad is a surgeon, a vascular surgeon. So I went in thinking that, and my parents knew me so well. I always had this essentially a photographic memory. I could remember textbook pages based on, you know, the photo and what page it was on and what it exactly looked like and what text was under it.
Wow.
Yeah, it was
That's
crazy.
handy.
But I mean, for good and for bad, right? So I was always so visual. I always wanted to know the answer, always. Well, why did this happen and why did that happen? And so my parents always had pathologists as friends, and we still have them as friends to this day. They live just by them in Florida. And they were always chirping in my ear, check out pathology, check out pathology. And I was like, no, that's for nerds. I was like, I'm not a nerd. There was a stereotype, you know, the smart people that always knew the answer, the doctor's doctor, and I was like, I can't do that. Well, fast forward, you know, I got into medical school and it wasn't so nerdy and it was so cool, and I ended up teaching the pathology course and being a TA, running, I did that actually in residency, but in medical school I ran a pathology interest group.
What made it cool to you?
Because it was the answer, because it was all visual, it was colors, and you looked at slides under the microscope. So it was all picture-based and pattern-based and cell on a cellular level. And then we have the answer, right? The surgeons are waiting to hear from us. Is this cancer malignant? Or is it, you know, invasive to what level? You know, what do I do next? Is this lymph node positive? That was our answer, right?
Wow.
So, and being a pathologist, you do this for every disease of the whole entire body. So I'm boarded in pathology and can diagnose every organ, every disease, everything under the body.
Wow.
But back to medical school, I got to one point during my rotations and I had to wake up at 3 a.m. to pre-round on my patients. And I just got up that morning, I said, this is not the life I want. I want to be a career woman, but I want to have a family and I want to enjoy my life. And I ran to my friend who's a pathologist and I said, I'm doing pathology. So from then on, I never looked back. I got so interested in skin because I think it's a beautiful thing. Everybody has it. It's also extremely difficult because there are very subtle changes under the microscope that have to be interpreted to make huge different diagnoses. And it's also very competitive, and I'm a competitive person. So I decided to do DermPath, and that's a shorter term for dermatopathology. And I never looked back. So, yeah.
Do you ever feel, I would feel like this sense of deep responsibility.
Deep responsibility.
Does that ever weigh you down, or does it excite you? Does it make you feel like I'm giving something, of course, giving something really valuable to the patient or the surgeon, but do you ever like take that with you and be like, does it stress you?
Yeah, it's extremely important and it is very heavy. And I think the biggest takeaway I had early on was you never should hesitate to ask anyone if you have a question. Also goes to business, right? But nobody knows everything, and you have to use people that have been doing this for a long time and learn from them. And I had mentors that helped me along the way, and I never was scared to ask any question. There's never a stupid question. And so I think that helped. Yes, it's always stressful having a job, but you have your residency and your fellowship to really get a grasp of what it's going to be like when you're on your own. But always phone a friend because it won't ever hurt.
Did you have one particular mentor that really helped you that you turned to a lot?
I had a bunch, but you know, several of them, even now I still talk to my fellowship directors and attendings in Vermont from dermatopathology and pathologists from my medical school. So, you know, it's important, yeah, and it's just really, when you deal with such important material.
It's life and death for some people.
It's
right?
life and death, yeah. And it's also important to have communication between the clinical team. When you're taking care of a patient, every slide under the microscope is a patient. And so as a pathologist, you can't forget that because, you know, you're in your office and you're looking slide after slide after slide, and those are all people. Right. So it's really important. And you shouldn't feel like you can't pick up the phone and call the clinician and ask questions, you know, tell me more about this patient or whatever, because you're a part of the team.
Well, that's great.
Really
so the pathology was really exciting, but then you pivoted a little bit. Yeah. You were on this path. Tell us how that pivot went from this really strictly medical, you know, sort of educational path, and then to the aesthetic path. How did that happen?
So I definitely took a leap. I had been introduced to injectables a long time ago, even before my fellowship, and always just had this, you know, artistic thing about me, from dancing to perfectionistic qualities to visual. It all kind of comes together. Yeah. And I have always had the idea of doing something like this, but I never there's never the right time. And I just decided about 1.5 years ago, I can't believe it's been that long, but only been that long. It's just this craziness, to just say I'm going to do it. And I took a leap, and I didn't have any mentorship. I didn't have anybody to help me. And I said, I'm going to figure it out. And one foot in front of the other. I mean, from the day I decided I'm going to do this, it was about, I don't even know, 2 weeks, and I already had my LLC. And I decided I'm just going to start small, because I had my dermatopathology career.
Right.
I love it.
Yeah.
And I was going to do this on the side. And I was like, this is going to be in one room of a business. And I said, it's just going to be in this one little room. You know, we'll see how it goes. And within months, it was the line out the door in this one little room all by myself. And now we've grown so big. So yeah, it was just kind of I say gradual, but I don't really do anything gradually.
So what do you think? What do you think was the magic sauce that made your business have a line out the door? What was it? Is it that people are really excited about all the breakthroughs in beauty? What do you think it was?
I have a very different approach in all aspects of my business. I was not this huge office. There's nothing wrong with huge offices, but people want to be felt like they're taken care of. And I spent so much time talking to my patients about all the different options. I'm extremely honest, almost to a fault. I turn people away because I feel like, you know, I can't do what they're looking for. I'm very minimalistic. I am so much less is more. You can always, always, always add. But in the cosmetic world, people have gotten, you know, a little bit out of control because we lose perspective of where we came from and where we are now with regards to their own aesthetic appearance. So I believe in this is a little bit of jumping ahead, but when it comes to Botox and Dysport and neurotoxins and filler, I believe they work best together in a gentle global rejuvenation way. And putting material in places of the face that don't fill, for example, you know, fill and get these huge cheeks, or fill and get, you know, huge lips, okay? That's a big thing. But it's about changing the way the muscles and the tissues lay around that filler to actually support and lift versus filling. So it's a very different approach. I know this is like getting a little bit ahead.
No, it's great. Is the other way what is most common?
It's not that it's another way, but I think,
is it most common that people just do the
filler? They want more and more and more and more, but it's not about more and more and more. It's about putting, you know, I think a lot of people will do them in combination, both the neurotoxins and the fillers. But I also think it's, you know, patients, it's a different industry because patients come to you saying, I want lips, right? Because that's what they feel like they want. And I totally acknowledge that and understand that. But patients come to me to get my evaluation from top of the head to clavicle. I measure the face with calipers. I draw all over the face.
Wow.
And I give them kind of, this is what I think would make you just look better than you look. Not different, not enhanced, just a glow up type of thing.
I love that because I can imagine it's true that people might see something like someone's lips on TV and they go in and say, I want these lips, and it might not be proportionate to their face.
Exactly. And there's some people that will just do the same lip on everybody's face. Well, that's not, to me, I mean, maybe, you know, to me, everybody is different, and you can't make somebody who has, you know, a very tiny mouth, this huge, it just won't match their face, right? And so I just try and match everyone's face, keep them looking like themselves, but a better version of themselves.
Do you think that's why your practice has grown so quickly?
I really do. I think my honesty, my transparency, there's never a dumb question. I want people to come and ask anything. You know, I'm very honest. I do before and after photos so they can see where they came from. You know, I care about my patients. I love my patients so much. To a fault, almost, I spend an hour and a half with them, you know, and it's getting to be a little difficult. And I'm seeing now my patients bringing in friends and their family members, and people are coming from Rhode Island, New Hampshire, New York.
Time to scale.
Yeah, I know, right? My parents are like, so when are you going to franchise in Florida?
Yeah, that's
so
great.
I think, you know, I think it's just, you know, a passion of mine, and I'm making people feel so amazing about themselves. And also from a medical perspective, I have patients that have had radiation to their face, surgeries that we then replenish the volume that's been lost from radiation with filler to make them feel like themselves again, which is also just it's just amazing.
Yeah, that is amazing.
Yeah.
So if somebody is thinking about it, if maybe they've not dipped their toe in and they're not sure, what would you recommend to them to say, like, you should start with this, or doesn't it work like that? You just say, how would you prescribe to someone to start that process?
Yeah, I think people come in saying, I want to feel better about myself. You know, it's often, you know, you have the younger people that have done their research and they want to prevent, right? And that's awesome, because when you start preventing early, you don't have to do a ton of stuff later, right? But I think it's more often that I get between the 35 to 45 post babies, all of this, and they come in and they say, I just want to feel better and I don't feel like I look like myself anymore. You know, you haven't been sleeping and we're tired and all this. And
if you have a cure for that, no wonder your line's on the door.
You know, it's one of those things where they're like, I know who I am, but when I look in the mirror, that's not who I am. And so, you know, we talk about all the different options. You know, it's not only about injectables, it's also about amazing skincare, and it's about, you know, maintenance with other types of treatments. I do dermaplaning, which is awesome. It's a manual exfoliation that essentially shaves the face and gets rid of all the grime and the dirt and the grease that's on there, so that you have a clean slate. And all those products you're using go in so nicely and efficiently. Chemical peels are awesome. I have a certain type of microneedling that's really fantastic. So it's a combination of all these things and using them for some time.
Yeah, and that's why, hearing you say all those things, I'm like trying to keep track of what you're saying. But that's why it would make sense to go in and have someone walk you through the options.
Yeah, exactly.
As opposed to like the layperson trying to drive the ship.
Right.
Going and say, what do you as the expert think would be the best approach for me?
Right, and there are so many things out there. There's cool sculpting, there's this and there's that, and there's all these machines and all these lasers and all these facials. And they're all great. You know, I think, you know, I have chosen different services in my practice that I so wholeheartedly believe in because I've seen them work. And it doesn't mean they're the only ones. It doesn't mean that there's not other things. And I'll tell people, you know, my skincare line's not the only skincare line. I just want you to try it. I believe in it. I see it work. I use it. So it's just, you have to try it, right? Yeah. And it's a combination of things, but the services I've chosen really work so well. So
that's of course. I mean, you wouldn't be doing it if you
exactly. And if I find that there's something that, you know, I don't like about them in the future, whatever, I don't use them, or I don't bring them on. But I'm telling you, every day there's a medical sales rep in my office that decides to just show up and say, I want to sell you this. I'm like, I'm not interested right now.
So what are the trends? What are people looking for the most? What do you do the most? What are the trends, and how has that changed over time, do you think, that people are looking at improving their looks?
Yeah, I think, well, the number one change is that, you know, neurotoxins and fillers and all these injectables are so much more widely talked about and publicly talked about, because before, not only has Botox, the brand, been around a while now, and Dysport close to that, these are both common neurotoxins. They were kind of hush-hush, you know, and now there's still a little hush-hush. And I have, you know, a mix of patients that most of them are actually pretty public about it. And if they're not public about it, after they get to the point where they're like, oh my gosh, I can't believe what you've done for me. Today I had a patient that was crying because, I mean, you change people's lives. Yeah. But then they're like, I want to tell the world. So it's, I think that's the biggest change. And the trend is more prevention. So, you know, before people would wait and then go get a facelift, you know, and facelifts are still very popular, and they're relatively easy now. I mean, it's still a surgery, you know, there's still downtime. It's nothing like injectables. Injectables have zero downtime. I mean, maybe some minor bruising. And the results just get better with time. But that's, I think, what has changed the most, is coming in earlier. You know, I have patients in their early 20s getting, you know, a little bit of baby Botox. And for some of the people, you know, in their early 30s, neck neurotoxin is really common now, just to prevent the pulling on the face. So just relax the neck. So things like that don't change your appearance, but are preventative, I think is one of the biggest things.
Yeah, it's interesting. I think it's interesting the whole weirdness around it. I find that really, I find the weirdness around it weird, because
doesn't everybody want to be beautiful?
Well, and also like we do, we paint our homes, we put flowers on our front step,
exactly.
we dye our hair. Why is it any different? We want to live as optimally as possible. I find it weird that people get weirded out about it.
Well, and I think the one thing is that, you know, some people think everybody's starting to look the same, and there's something to be said for that, right? You know, there's a fine line there.
Yeah. Are there any differences? You know, you grew up in Florida. Are there any differences region to region?
Oh, totally.
So
how people look?
Yeah. Well, and what they want. So what's the vibe for
Go to Miami and you get really big lips.
Okay.
No, I'm just kidding.
Well, what about Boston, like the New England area? What's the?
Boston is very conservative.
Yeah.
Extremely conservative. I mean, it does vary. It varies based on kind of where you are in Boston, but Boston's conservative.
It's because everybody here's naturally beautiful.
Everybody's so beautiful. The snow makes you beautiful.
Oh, I don't know about that.
No, but I know. You know, we're more conservative.
Yeah.
And it's more of baby steps. But, you know, I think, you know, if you go to LA, all these places, it's like, it's so widely talked about. I mean, it's not even a thing. Here, you know, we're getting there.
So I have a question about sort of your path again to getting to this place of aesthetics and injectables. Was there any, was your family, your mentors, all these people that saw you going down this strictly pathology path, were they surprised that you did that? Were they supportive? What was that transition like?
So interesting. So the majority of people are so proud and so supportive. I think people expected it. So when not necessarily to open up an aesthetic practice, but when I was in dermatopathology, I in myself knew that I love it so much, but I'm not that person to kind of sit in one job for the rest of my life doing the same thing every day. I knew I was going to have variety. I knew I was going to be an entrepreneur in some way. I wanted to invent something or do something. I just always knew it. I wasn't quite sure what it was going to be. And so then when I decided to do this, everybody was like, of course you're doing that. And you know, I did everything myself. And to this day, I do everything. I do all my social media. I do all my marketing. I do all my brochures, everything.
Wow.
Literally everything. All my mass emails. I have an amazing website designer, but I can go in the back end and edit all of it. But that is something that has been so amazing for me. I've learned so much. I'm like, I can do anything now. I know I literally how to do all of it. I know from labels and Bloomingdale's, the little creams and all that. I'm like, I can do that.
That's very cool.
So I bought a specific printer to do it. I mean, I just have so much passion. And I think I have a creative side and the artistry of all of it. I just love doing it.
Yeah.
My husband's like, you need to hire someone to do all that. I just want to do it. I'm so proud of doing it. But I don't know how long it's going to last.
Well, there'll be a point. There'll be a point that you have to hand it off. But the thing is, you're the boss. So whenever you want to go in, you can dip in and do that.
Totally.
What would you say to somebody who feels that? You said, I always knew I was going to be an entrepreneur. What would you say to somebody who's in a traditional path and they have that tickle in their chest of like, I think there's something else. I think there's a pivot coming. What would you say to that person?
Well, it's really interesting. I'll start with something and then get into that. So I have to say, I think, maybe I'm wrong, but I probably am the only, if not one of the only, dermatopathologist, pathology trained that did this. And I think that you have to have a certain type of skill. And, you know, I took a leap and I went a different path. And I had a little bit of pushback, but nothing serious and nothing that would have ever stopped me. And after I did that, I had a handful of dermatopathologists that said, how did you do this? This is so amazing. I want to do it too. One of them I know is doing it. And it made me so proud. And you just have to, you know, go after your dreams and do what you feel like you have a passion for and a talent. A talent doing these types of things. And you know, I asked people, but I also did my research. So and the other thing I have to say is, I forget who it is, if it's the founder of Amazon or Google. I think it was Google. My husband told me, I can't remember. But I never was more than 80% sure of a decision when it came to business decisions that would keep me from moving forward, okay? So I am a perfectionist and I want everything to be perfect, but I realized that I can always change my logo. I can always change the name of the practice and rebrand. I can always move my office. I can always change the furniture.
Right.
So I just move forward.
Right.
I'm not gonna let that stop me. And so, you know, my logo is one thing that I've kept and I'm absolutely obsessed with. You know, I can always change my software, which I've changed. So all of those little things, I think physicians are so like, it can only be this way. Things change and evolve. And so that helped, right? So somebody that's starting off, don't let little things like that stop you. Start small, find a space, you know, think of a name, but find a space, because your name and all that you can change. But if you have a physical location and you're like, wow, like I'm doing this. I'll never forget my first order of medical supplies and Amazon. I'm like, oh my gosh, I'm doing this. And then it like comes in the mail and you're like, oh my gosh, this is happening. And then it just keeps going.
Yeah. I love what you said about you can always change things.
You can always change.
And I always say like branding is not a fixed, it's not a destination. It's a point on a line that's moving.
Totally.
Because you're evolving as a human being and your business is always evolving. And yes, you want to have great branding, you want to have a great website, but it doesn't mean it has to be the same thing, and you can always change it as you grow.
My website was hacked. It was all Japanese one day. I was like, oh, well, that's awesome. So I had to redo the whole website. You know, things like this happen. And I think that people get scared. They're like, how did you do this? How did you know what to do? How did you? And I'm like, you know what to do.
Right.
You just have to kind of write up a plan of, you know, I didn't have any marketing when I started. I just had my office and I had my medical supplies and word of mouth, you know, word gets around. Your patients are your advertisements. That's the other thing.
Yeah, that's right.
It's
clients
not about
too.
your website. I mean, yeah, they need a place to go. I mean, patients couldn't ever book online when I started. It was all phoned onto my cell phone, email.
Because you were delivering results. It's
right.
not about the website, it's about the results.
It's about those patients walking around and their friends saying, what are you doing? You look amazing. What are you doing? Tell me.
Right. And the other thing I'll say is that sometimes when people come to me, they're like, I did this, I don't know how to bring this together. I don't know if I should keep this. And I'm like, you are the brand.
Yeah.
And what you did is exactly, I don't want to say right, but is optimal, where you tapped into all of the pieces of who you are to create something that's really aligned. And that's one of my favorite words in branding. It's aligned. It's aligned to who you are. It's aligned to your path. It's aligned to your expertise and your passion. And I think that's a really key part too.
Yeah, and my husband will say, like, it was hard, right, obviously, you know, with little babies and starting a business. And but he's like, I've never seen you happier. I mean, I just love what I do. I can make my own schedule, right?
Yes.
So if I want to go out and, you know, do something for the business and charities, I do tons of charity events and love donating. But I can do that, you know, I can do whatever I want. Obviously, I want to continue to grow and have all my patients and room for as many patients as possible. And I'm getting, I feel like, to a max, and I have to.
So if you're someone who wants to come and find you or find your website, how can people find you? What's the best way for people to get in touch or to find Dr. Gretchen Freeling?
So we have
online?
a huge presence on Instagram.
Okay. Is it your name? What's the name?
It's GFaceMD, and then it has, you know, it's Dr. Gretchen Freeling / GFaceMD.
Okay.
The website is beautiful. It's been through a lot of kind of transition, and it's very easy to book online.
And what's the website name?
It's www.gfacemd.com.
Okay.
And I have a whole skincare shop on there with all my skincare products. You can buy them. There's videos of people applying them.
Nice.
So the website, Instagram, email, always. You can email info@gfacemd.com.
Nice. Well, I want to thank you so much for coming. I'm like, oh, what do I want to try?
It's already been 30 minutes.
I know. I told you it was going to fly by. But before we finish, I always ask, what does it mean to you to thrive?
What does it mean to me?
Yeah, what does it mean to you to thrive?
It means to me to live your best life, be happy, help others, get out there, change people's lives.
Wow. Well, you are certainly an example of
There's
that.
a lot more there.
No, in your helping people, I just, want to give you props for, really using your skills and your talent to make people feel better inside and out.
Thank you so much, and thanks for having me.
Absolutely, it was my joy. Thank you for being here.
Thank you.
And as always, thank you as well. And until next time, here's to hitting all your high notes. Take care, everybody. Bye-bye.